Be sure to have all of the following items before you begin: gonal F RFF Redi-ject Pen, 1 single-use disposable needle supplied with the pen, alcohol swabs, sterile gauze, and safety container. Take a moment to examine the pen and the medication. The pen should be at room temperature and the medication in the pen should be clear. There should be no cracks in the plastic window and there should be liquid in the reservoir. The liquid should be clear and colorless with no particles. Get another Redi-ject pen if there are cracks in the reservoir, there is no liquid, or the liquid is not clear and colorless. Check the dose display in the Redi-ject pen. If there is any number other than 0 on the dose display, set the dose display to 0. To set the dose display, turn the dose knob in a counterclockwise direction until you see 0. Remove the pen cap and clean the pen tip with an alcohol swab. Remove the peel-off seal from the outer needle cap. Hold the outer needle cap in one hand and the pen in your other hand. Place the needle on the end of the pen where you see the threads and screw the needle onto the pen in a counterclockwise direction until you cannot turn the needle anymore. Gently remove the outer needle cap and place on a clean, flat surface to use later. Leave the blue inner needle shield on the needle. Small air bubbles in the pen's reservoir do not need to be removed from the pen, but large air bubbles in the pen's reservoir must be removed. Note, a large air bubble is a bubble that appears all the way across the top of the reservoir. If you do not see a large air bubble, go to Step 4 to select the correct dose of gonal F RFF Redi-ject. If you see a large air bubble, turn the dose knob in a clockwise direction until the dose display reads 25. Meaning 25 IU. Only use 25 IU to remove air bubbles. Carefully remove the blue inner needle shield and throw it away. Do not recap the needle with the blue inner needle shield. With the needle pointing up, tap the reservoir with your finger to allow any large air bubbles to rise to the top. With the needle still pointing upward, slowly press the dose knob as far as it will go. Release the dose knob. Find the outer needle cap and place on a flat surface. Holding the pen in one hand, slip the needle into the outer needle cap without using your other hand. Using one hand, push the capped needle against a surface that is firm but not slippery, like a wall. Push until you hear a click. Pushing the capped needle against a wall will make sure the cap is firmly attached. Turn the capped needle in a clockwise direction to unscrew the old capped needle from the pen. Discard the needle in your safety container and replace with a new capped needle to complete your injection. Turn the dose knob in a clockwise direction until your prescribed dose of Redi-ject shows in the dose display. Do not push or pull the dose knob while you turn it. If you pass your dose, simply turn the dose knob back to the correct dose. Confirm you have selected the correct dose by looking at the dose display on the pen in bright light, like by a sunlit window or under a lamp. Your healthcare provider should show you the injection sites to use around your abdominal area. You should change injection sites each time to reduce the chance of a skin reaction. Clean the injection site with an alcohol swab and allow to air dry. Make sure the dose on the dose display matches your prescribed dose. If the dose does not match your prescribed dose, adjust to the correct dose. Carefully remove the blue inner needle shield and throw it away. Do not recap the needle with the blue inner needle shield. Hold the pen at a 90-degree angle and insert the needle into your skin. Press down on the dose knob with your thumb and hold the dose knob as far as it will go to complete the full injection. Keep the needle in your skin for at least 5 seconds to make sure you receive your full dose. Remove the needle from your skin and place the pen on the table. Apply pressure using a gauze pad. Find the outer needle cap and place on a flat surface. Holding the pen in one hand, slip the needle into the outer needle cap without using your other hand. Using one hand, push the capped needle against a surface that is firm but not slippery, like a wall. Push until you hear a click. Pushing the capped needle against a wall will make sure the cap is firmly attached. Turn the capped needle in a clockwise direction to unscrew the old capped needle from the pen. Discard the used needle in your safety container. Replace the pen cap. After you use the pen and there is still medicine left, store your pen in the refrigerator or at room temperature up to 28 days.